Don't think about the consequences. Throw me in the dirt pit. Don't think about the choices that you make. Throw me in the water. Don't think about the splash I will create. Leave me at the altar, knowing all the things you just escaped. Push me out to sea on a little boat that you made out of the evergreen that you have.
Most American teenagers are just trying to survive high school while having fun. However, for millions of teenagers, education and fun don't seem so important. Their daughters and sons now come first. Teen pregnancy is becoming more and more common, so common that 2,000 teenagers get pregnant every day in the U.S. For sexually active teens, it is crucial to be informed about the different types of birth control. The two parts of understanding the importance of birth control are the responsibility of the individuals and the agreement between the two partners. If you want to be well educated and to prevent yourself from becoming a teen parent, you should get a pen and prepare to take a few notes. These are the notes you will want to keep. The most effective type of birth control doesn't require money or a doctor's visit. The only birth control that is 100% effective is abstinence. The advantages of waiting include no difficult emotional or physical consequences. The second most effective type of birth control that does require a doctor's visit is called implanting. It is an implant of a small rod about the size of a matchstick underneath the skin of a woman's arm. You can feel it, but it's barely visible. This implant works by releasing a hormone called progestin, which prevents the release of eggs. The implant works for up to 3 years and is 99% effective. Another effective type of contraception is called the IUD, or intrauterine device. It is a flexible T-shaped device that is inserted into a woman's uterus. The IUD also releases progestin and can last up to 5 years. It is 99% effective and requires a doctor's visit. A woman can also get the shot, also known as Depo-Provera. It injects progestin and is 99% effective. A woman can also go on the pill. Birth control pills release hormones such as estrogen and progestin. These should be taken every day and only with a prescription. The pill is 91% effective. A woman can also get the ring, also known as NuvaRing. The ring stays in a woman's vagina for 3 weeks, and she can't feel it. This also releases hormones and is 91% effective. The last type of contraception that you can get from a doctor is called the patch, also known as Ortho-Evra. It's like a nicotine patch and can be worn anywhere on a woman's body, her arm, her butt, her legs, but never on her breasts. The patch is 91% effective. I'm going to tell you about 2 more types of birth control that don't require a doctor's visit. I'm sure you've all heard of condoms. Condoms can be bought online at drugstores and clinics. Male condoms are 82% effective, and female condoms are 79% effective. Plan B is another option. Plan B is not like regular birth control. It prevents pregnancy after unprotected sex and should be used with caution because it contains high levels of hormones.
I'm definitely not ready for a kid right now.
It takes away your youth.
This is our time to enjoy our lives.
I would have to put my life on hold. We can think about ourselves and our future.
You have to think about yourself before you think of anything else. And then once you get pregnant, even if you're going to give it up for adoption, you have to think of the baby first. Are you going to be able to give it everything it needs? And you might have to put it up for adoption, or you might have to get an abortion, whatever is best for the baby. Teenage girls who are getting pregnant, they're still growing themselves, so they need extra nutritional support for them and the baby, which can be hard to get sometimes.
Not the exception, as it happens so many times. And I used to not believe it. I was like, oh, it doesn't happen. And then I came to high school, and I saw, like, a pregnant teenager, like, for the first time, and I was like shit, like,
What do you think when you see pregnant girls walking around school?
I don't know. I don't really react to it. I just kind of see it and I'm like, oh, like damn, that's gonna make their life pretty tough.
If I actually got pregnant, I'd be really freaked out. I would be devastated.
I would be really depressed since I'm too young for a child.
I might have a better life with someone, and if I did give it up for adoption, it'd be an open adoption.
I don't think I would have enough responsibility. It would affect my education because I wouldn't even be able to come to school. I wouldn't be able to go to college, and I really want to go to college.
My grades would go down so much because I'd be taking care of the baby and like up all night.
What would you do if you had a girlfriend and she got pregnant?
Ooh, that's a tough one. Oh man, I have no idea.
I'd probably ask what happened. Like, I'd be scared out of my mind.
My grades would probably go down.
I'd probably lose my grades.
I think it'd make school a lot harder.
Well, I would be having to take care of the kid, and I won't be able to come to school, so it'd be kind of hard.
And I'm already lazy, so adding a child on top of that would, and probably a job to support the child would really make it difficult to learn.
I won't give it up for none. I'll try my best to support it.
If I could support it and I could treat it the way it deserves to be treated, yeah, I'd keep it.
I'm gonna have like 10 kids if I'm rich. Yeah, I really support parents, so I'd probably try to ask them. And if not, I'd probably be able to go to college. I'd probably just get a job now.
Would you be scared?
Hell yes.
Because if I have nothing, you have nothing, you got bait, listen, we gotta work something out.
I think teen girls should be focusing on their schoolwork and when they go to college to get a good degree.
School.
Graduated.
Education.
Work and school and trying to do good things.
You're so young and you have so much to look forward to.
Figure out who you are and what you want to be.
Your future comes first.